Good morning, good evening, ladies and gentlemen. Thank you very much for listening to my presentation. I am Paola Berberino, the Chief Executive Officer of Alzheimer's Disease International. I would particularly like to thank the President of IAGG, Jose Ricardo Jauregui, for inviting me to speak in this particular session. And I hope you will find the presentation interesting. I will not be touching on all the areas I would like to touch because of timing. If you will need to know more, you can always contact Alzheimer's Disease International in London. Now I'm going to share my screen with you, and so you're going to see more of the presentation and less of me. I'm going to talk to you about a global policy update on the Global Dementia Action Plan, and I'm going to focus on 4 of its main areas. But first, a few words about ADI. We were established in 1984 and are the umbrella organization of Alzheimer and Dementia Association around the world. We have 105 full members, only 1 per country, plus another 20 countries in development. We represent our members at the WHO, at the UN, OECD, and other global and regional bodies. We promote World Alzheimer's Month, which I'll tell you more later, and we publish the World Alzheimer Report and a lot of other publications. Our vision is prevention, care, and inclusion today because we don't have a cure. We hope there's going to be a cure tomorrow, but we don't. Let me tell you a little bit about ADI strategy. We were founded in the 80s, as you know, as I've told you earlier, by the 4 largest Alzheimer associations in the world, the US, UK, Canada, and Australia. At the time, they were the largest. In the first phase, ADI built the international network that enabled us then to become a recognized body, a non-state actor with the WHO and with the UN. That was phase 2. And then for about 10 years, until 2017, ADI worked on advocacy at the WHO level to get a standalone action plan. And as you know, standalone action plan for health conditions are quite rare. And it's very fortunate that we got one on dementia in 2017, which was underwritten by all the countries that belong to the WHO. And that basically would mean that then all the country would have national dementia plans or strategies. However, having seen a lot of these plans not being action and remaining as just pieces of paper, I changed the strategy of the organization to increase our multilateral presence to other bodies, the OECD, the G7, the G20. We created an ambassador program. Queen Sofia of Spain and Queen Silvia of Sweden, for example, are part of the ambassador program. But we also strengthened regional networks. In Latin America, for example, the Inter-American Development Bank and the PAHO have been organizations we work particularly with. And ultimately, we're working more at national level with action plans to try and make sure that governments action the plans. And I'll tell you a bit more about that later. I moved too quickly. And the final bit of the slide is the movement. So I'll talk more about how World Alzheimer's Month is becoming a millions people movement. We are now creating a movement of people around the world because we believe that unless we get citizens to do something about dementia, demand their governments for change unfortunately will not happen. So let me tell you a few figures. Every 3 seconds, someone in the world developed dementia. We estimated back in 2018 that 1.3 trillion was the cost to society of dementia, but that's supposed to get to 2.8 trillion by 2030. It's a huge sum, which one can't even think about. The latest estimates on prevalence give us the growth of people with dementia from 55 million, which is the estimate for today, to 139 million in 2050. And we have to remember, as you well know, being an audience of geriatricians and gerontologists, that all the families are impacted. And so these impact a much larger number of people. At the moment, dementia is the 7th leading cause of death globally. So as I was saying, in 2017, the WHO approved this global action plan, which has 7 main areas: dementia as a public health priority, dementia awareness and friendliness, dementia risk reduction, dementia diagnosis, treatment, care and support for dementia carers, information systems and data sharing for dementia, and finally, research and innovation. I'm going to talk to you today about 4 of those areas: public health priority, awareness and friendliness, diagnosis, treatment, care and support for dementia carers. This is not because the others are not important. Indeed, we believe strongly that all areas are essential and critical to really provide a better life for people living with dementia and their families, but simply because there isn't time. In this slide, together with the Dementia Plan Guide of WHO, you see the Plan to Impact report. This is a report that we've been publishing every year since 2017, since the launch of the Global Dementia Action Plan, in order to check what is the real impact. So governments report back to the WHO on something called the Global Dementia Observatory on their progress, but we ask our member association on the ground to check whether what the governments are saying is really what is being felt by people on the ground. This has now become a really important point of reference for the development of the plan, and indeed an important point of reference for other organizations that have plans. This is a picture taken last week in Geneva. I'm talking to you, I'm re-recording this at the end of May, and we were at the World Health Assembly last week at the launch of Plan to Impact 5. Together with me are Dr. Tarun Dua of the WHO, Dr. Tam of the Canadian government, we are Dr. Shah of the Minister of Health in the Maldives, Irina Shevchenko, who is our member for Ukraine, the Minister for Healthy Aging. What a beautiful title. Minister Abela from Malta, Birgitta Martensen, a former CEO of Alzheimer's Switzerland, now herself diagnosed with dementia, and my deputy Chris Lynch, all in this picture. This was a very important step forward. There's been a lot of interest from government this year on the plan. So why national dementia plans? Plans are the best strategic planning tool. They put the focus on diagnosis, post-diagnostic support, and care pathways for people living with dementia and their carers. They focus on public health campaigns, increased awareness, combating stigma, such an important thing. In 2019, we did a global survey that pointed out that 62% of healthcare professionals globally still believe that dementia is not a disease, but it's just normal aging. So you can imagine the scale of the job we have here. Plans also focus on healthcare professional training, of which there is a lot of need. They promote a risk reduction message, they measure and track prevalence and incidence, and then they prepare governments for a drug breakthrough. We published another report I won't talk about last year around the lack of healthcare system preparedness, for example, in Europe. All care systems in the world are really not prepared for a possible drug breakthrough. So what are the tools for developing a plan? A plan should be having a number of areas. I've talked already of some of them. I'll focus here on timely diagnosis, of which we haven't talked about, the ideal scenario of support at home and support for family carers, in coordination of care, including community care. Also, the plan should have an element of understanding of human rights, disability support, and enablers for those. And also there should be an important commitment to research, which, as I said, is still not very developed in many countries. Where are we with the plan? So in red are the countries that actually have a plan. In gray, the ones that are developing one, although some of them have been developing one for ages. And in the red category, some countries have a plan, but they haven't funded it, which is also not very good. And then in pink, unfortunately, are the largest swathes of the world where there are no plans at all. And really, Africa is here very relevant. But also in the red, there is a lot of issues. A lot of countries, as I say, do not have funding. So having a nice plan is a nice piece of paper. Mexico, for example, is one. Italy has been one for many, many years. All countries where Indonesia is another one. Lovely plans, lovely intentions, but no budgets. With no budgets, there is no real improvement in the life of people living with dementia. Here it gives you an idea of the national dementia plans for WHO region. So you have the African region, there are none at the moment. We hope that Kenya will be the first one, but we've been hoping for that for a long time. And as you can see, a lot in the European region, but also the region of the Americas is all covered. And this also gives you countries and territory with a national dementia plan or with the dementia integrated as part of a wider health plan in development. So there is a few countries where that is the case, very interesting, but there is quite a lot more that we need to do to see these plans to fruition. Another slide that gives you the actual implementation and adoption in gray. In this one, the national plan adopted. You can see the contrast. We still need 134 member states to do something, and there is no plan to meet the targets of the Global Dementia Action Plan. In summary, you can see here from 2015 how many plans years have been approved. In 2016, you can see there were more than 5 plans for the first time, but then most of the years has been less. In 2022, there's been there is a lot of plans in development, but even if all of them came to fruition, and without it would only be about 9. And in red, the big bar charts tell you how many plans we would need every year in order to meet the targets. As you can see, it's very, very unlikely that we will meet those targets. Because we know that there is a problem, and because we know that there is a lot of lengthy issues, we decided in December to, given that we are halfway through the plan, and given that the WHO itself published the report that confirmed that the progress is too slow, we decided to find our own way to bridge the gap towards the key target. And in trying to do that, we officially launched the campaign, What's Your Plan?, which is aiming to galvanize partners, governments, associations, country offices, etc. Sorry, there is a typo in the slides, which should be associations, to work together to develop, fund, and implement national dementia plans. And we build momentum to the World Health Assembly and from the launch of Plan to Impact 5. So the plan and the campaign have been developing hand to hand. We have now working with 40 governments and organizations in 40 countries to accelerate their plans. And we've recently met with ministers of health in Botswana, Palmyra, Cameroon, and St. Lucia, for example. We've had positive assurances to develop a plan from Lithuania, Poland, Trinidad and Tobago, Panama, and Brazil. And as you can see here is a sample of the letters that are coming to and from ministries. It's a very interesting campaign, and we have been quite surprised by the number of positive assurances and positive steps that ministers have taken. So far, we haven't really had a need to unleash a media campaign, although we will do that if governments don't respond. Now, just to give you an idea, these are the 40 countries we are currently working with, and you can see at which stage of the plan they are. So some of the countries, I'm not going to explain the stages, you can find it in our Plan to Action report that you can find on our website, www.alzint.org. So many countries, even, we are working even with very high income countries like New Zealand, where the plans are still not at a full development stage. So a stage 5 plan basically is a real plan, funded, approved by a government, launched. But many of these countries are at a very preliminary stage. However, they are considering it, which is better than nothing. Now, I'm concluding my bit on policy, although, again, you're very welcome to ask for more questions. And I'm now passing to dementia awareness and friendliness. So the target of WHO is to have 100% of countries that will have at least one functioning public awareness campaign on dementia to foster a dementia inclusive society by 2025. Why is awareness raising so important? Because there is so many things that we still don't know about dementia and Alzheimer's. As I said earlier, 62% of healthcare practitioners still believe that dementia is a normal part of aging. This came out as part of our World Alzheimer's Report 2019, the gigantic survey done by the London School of Economics and us on attitudes to dementia. This particular survey, we polled 70,000 people globally in over 50 languages, and this is what we found. We also found that 35% of carers globally have hidden the diagnosis of a person with dementia, and that 1 in 4 people still think there is nothing we can do to prevent dementia. So these are just a few numbers that can tell you why it is so important to raise awareness. And back again to the Global Dementia Action Plan. So as you can see, sorry, I jumped the slide, dementia awareness, and frankly, this is slide 2. The target is 100%, but there's also a target of 50% of countries to have at least one dementia-friendly initiative to foster a dementia-inclusive society by 2025. And we're doing quite well. And this is why we're doing World Alzheimer's Month. Every September, people come together from all around the world to raise awareness and to challenge the stigma that persists around dementia. September 2022 this year will be the new one, but September 2021 marked the 10th year of this campaign. As you can see, the campaign is translated in many, many languages, and it has plenty of interesting infographics and interesting way to convey the issues. The theme for 2022 was No Dementia, No Alzheimer's. It will also be the theme for 2022, but we have not announced it yet. And during the campaign, we shine the light on the warning signs of dementia and the importance of a timely diagnosis, and how diagnosis is a difficult process. Last year, the World Alzheimer's Report was on diagnosis. This year will be on post-diagnostic support, how important it is after a person has received the diagnosis that them and their family are provided support to understand what's going to happen next. This is a sample of all the materials that's translated in many, many, many languages. And this is a sample of some important monuments around the world in various countries lit up to celebrate World Alzheimer's Month. Some governments do it in purple, some governments do it in other colors. World Alzheimer's Month. So how many countries have been participating? Since 2017, where we had 50+ countries, we've now grown to 111 countries in 2021. So we're doing quite well indeed. And most shockingly of all, we have seen the social media growth of World Alzheimer's Month. We've been using the same parameters for this for years. From 2018, 800,000 people taking part to 45 million in 2021. So not only is growing, but is growing very rapidly indeed. There is huge interest globally around dementia and Alzheimer. A few more of the lovely materials on World Alzheimer's Month 2021. There is on the left and the right the infographic on the warning signs of dementia, and here is one translated in Indonesian. We also use this to highlight awareness at a number of levels. This is just a small sample of televisions and of newspaper coverage from last year, but we have hundreds of coverages in many languages in many countries. Now, let me tell you a little bit about the fourth area now. Let's pass to the fourth area, dementia diagnosis, treatment, care, and support. The WHO target is in at least 50% of countries as a minimum. 50% of the estimated number of people with dementia will be diagnosed by 2025. Now, let me tell you a bit about our work in the World Alzheimer's Report, which is widespreadly acknowledged as the most important document that came out on dementia. The one on 2021 was entitled Journey Through the Diagnosis of Dementia and was commissioned to McGill University in Montreal. It is really a global perspective on current dementia diagnosis practices, barriers and facilitators, emerging and imminent future impact of diagnostic breakthroughs, and a robust set of recommendations to improve diagnosis around the world. Now, this report is fully downloadable on our website. The report is a journey through the diagnosis of dementia, and it includes expert essays to encapsulate a broad range of knowledge. 113 healthcare professionals and researchers were invited. Surveys that were conducted concurrently between March and June 2021, targeting people living with dementia and carers, clinicians, and dementia associations, and testimonies of individual case studies requested from people living with dementia and covering all WHO regions. In addition to that, there's a larger set of videos that accompanies the report. There's also an executive summary that is available on our website, as the report is very, very large. As you can imagine, this is a very big topic. But let me tell you some of the findings. Globally, we estimated 75% of people with dementia are not diagnosed. And this equates to 41 million people undiagnosed globally. 55% of people in the survey say that they were given inadequate information at diagnosis. And that is a major gap in signposting for clinicians. On the other hand, 98% of our Dementia and Alzheimer's Association do provide this information. So it makes you wonder why clinicians are not sending people to Alzheimer's and Dementia Association for some information, at least. At the best, actually, we would love to see government having more the capacity to signpost this, because of course, in order to achieve bulk numbers, really, you do need the government to do more of this. The other thing we found out is the stigma is correlated with diagnosis. I talked about the 62%, but also look at these, 46% of people living with dementia and carers identified fear of diagnosis and stigma as a barrier to diagnosis. 47% of people with dementia and carers identify the lack of trained clinicians as well as a barrier to diagnosis. Many countries don't just not have diagnostic equipment like MRI scanners. They don't have geriatricians, they don't have gerontologists, psychiatrists or neurologists, and it's very difficult to get a diagnosis in these countries. People really literally are in the dark. And believe you me, the vast majority of people in the survey say that they do want to know, even if there is no treatment. People want to know what they have. There is no doubt about it. And then talking about the report last year and all these various reports we've done, last year we also focused on COVID-19, and how it had exacerbated an already complex and time-pressured diagnosis pathways. 90% of clinicians identify additional delays and wait time due to COVID-19. Time pressures and pay-per-visit models for primary care doctors are counterproductive to sensitive dementia diagnosis. 75% of clinicians see the increasing number of people seeking a diagnosis as a major challenge in the future, as diagnoses are increasing. And now we know there is a link between COVID-19 and cognitive deterioration. Those will probably and sadly increase even more. In short, the health system preparedness of all countries need to be improved. And we anticipate that there is going to be a tsunami of demand very, very soon for more diagnostics for dementia. And our government prepares, unfortunately, they are not, as highlighted in our report last year on healthcare system preparedness that also you can find on our website. So the report had some selected recommendations. Healthcare system globally should introduce annual brain health checkups for the over 50s, facilitated by evolution in biomarker science, with the opportunity to promote risk reduction strategies. The governments globally must urgently start to measure and record diagnosis more accurately. Accurate measurement of diagnosis rates is key to treatment, care, and support, to healthcare system preparedness, and to challenging stigma. Therefore, governments must prepare for a tsunami of demand for healthcare services, as we said. And these should result as a global aging population, improved diagnostic, including biomarkers, and emerging pharmacological treatments. The full list of recommendations can be found, as I said, in the report on our website. So the theme for the 2022 campaign of World Alzheimer's Month, of which I told you earlier, will focus on post-diagnostic support. Again, the hashtag will be No Dementia, No Alzheimer's. In many parts of the world, support for those diagnosed with dementia is insufficient, difficult to access, or simply not available at all. Throughout this year's World Alzheimer's Month campaign and the associated World Alzheimer's Report, we will aim to raise awareness of the issue and provide recommendations for how the system can and must improve. The new report is also commissioned to McGill University, that has made both 2021 and 2022 reports. The report will be available, of course, in September, World Alzheimer's Month. Now, let me talk you through the fifth area of the Global Dementia Action Plan, support for dementia carers. The target here is for 75% of countries to provide support and training programs for carers and people living with dementia by 2025. So in the continuing absence of a breakthrough, it's vital to expand the availability of post-diagnostic support and to improve it, and carers are part of that. The support doesn't just have to be for people living with dementia, although they obviously bear the brunt of it, but the carers are going to be massively impacted by this diagnosis. And the aim is to learn from innovative approach used elsewhere. Unpaid care at the moment accounts for 40 million full-time equivalent jobs globally, and it is expected to reach 65 million by 2030. It's absolutely critical to support dementia carers in order to keep our societies working. So as I was saying, just to go a little bit deeper into that, and to the left you can see our report on the global estimates of informal care that we published in 2018. The annual global number of informal care hours provided to people living with dementia at home was about 133 billion hours in 2021. That's equivalent of more than 67 million full-time workers. Globally, the cost of informal care for those living with dementia stands at $650 billion US, and carers often feel isolated and are at risk from physical and mental issues. And this is ever so true, and it's been ever more so true during COVID-19. WHO has published an important piece of work, the iSupport system for dementia carers, and that is primarily a self-help tool for caregivers of people with dementia, including family members, relatives, and friends. The manual comprises 5 modules and accompanying exercises about the introduction to dementia, be a helper, take care of me, provide daily care, and coping with behavioral changes. It can be adapted also to national or local context and needs, and it's been translated in a few languages. Now, this tool really should be distributed by governments, for governments to distribute to their primary care doctor, to give to patients, people living with dementia, to people that may need it, to carers. But the problem here is that iSupport is still not adopted by many, many countries. And you are all gerontologists and geriatricians here. Please be aware this tool is available. If you need something, if you're in a position to influence your government, make sure they know about it. This is provided freely by the WHO, which can also offer technical support in its adoption. So it's a simple way to help carers. The association obviously provide a lot of advice and support to those living with dementia and carers. And please do make use of our local Alzheimer's association. There is a list of them on our website. So whichever country you are in, you can always tell your patients to contact an association to see whether there are support groups and services provided. The association do a lot of contributions to care. Here you can see, for example, training for doctors and nurses on dementia care at the medical school in Costa Rica, which was promoted by the local Costa Rican organization. On the right, training on rehabilitation and physiotherapy, both in Guatemala and in India. So, and there are really literally associations all over the world. You just have to ask. In a crisis, caring for someone living with dementia is even harder. And of course, the recent case of Ukraine has proved that even more strongly. We have been we've been distributing tips during COVID-19. We also were one of the first organizations to publish about COVID-19 and dementia care on the Lancet. This is also cards that we have developed more recently for the Ukrainian conflict, about what to do with agitation, for example, during bombing. But we also have published a more generic report on crises, forgotten in a crisis, which tackles the issue from the point of view of other natural disasters, tsunami, floodings, earthquakes, etc. We need to remember that at these times, organizations really have an important role to play, and so of course all the medical professionals in the country. The recent conflict in Ukraine has also made us realize the importance of having some medication on the essential medicine list of the WHO. We knew about it already, but it's become even more sharply in focus, the need for distributing medication during this crisis, and we are currently working on that. And so we come to the last slide, a call to action from ADI. We really need here to remind you all that all member states must implement national dementia plans, which encompass all 7 action areas of the Global Action Plan. This is what they promised to do at the World Health Assembly in 2017. And as I said to you earlier in the presentation, so many of them have not done it yet. Organizations like IAGG can be instrumental in the approval of the plans. And indeed, the whole community of geriatricians and gerontologists could help us. Some of you will have access to the government, some of you to primary care doctor, some of you will have really absorbed what I said about the need to action, the amount of ignorance that there is in the world, and the desperation that people are feeling. Again, I would urge you to read the report in 2019, and in particular about the feelings of people living with dementia and of carers at the time of diagnosis. There is so much more that we can do. So if my presentation interested, if you were moved to action, if you feel that it's important that more people in the world do something about dementia, then please remember we are a big movement of people. There are millions of people behind us that know that this is important. Join the movement. Let us know that you're interested. If you think that your country could benefit from a discussion about this, be in touch. Our contacts are here for all of you to take note of. You can contact all of us, including me, on Twitter, on LinkedIn, on Instagram. Please make sure that you do get in touch and that you follow what we do at World Alzheimer's Month time. Join the movement. Thank you so much. Buenas tardes a todos. Good night, good evening, good morning for those that are watching online. I'm Paola Berberino, and I'm now live with you from London. I hope you enjoyed the presentation around the importance of having national dementia plans stemming from the Global Dementia Action Plan, and how the international geriatrics and gerontologists community can help us get there, as I know that a lot of you will be very interested. I thank all the directive of the conference for inviting me to speak on this topic. Now, it's very late in London. It's actually a beautiful evening, and I have been asked to see whether there are any questions. And if there are any questions, I will be happy to answer them. But it's also a very long session, and I understand if you don't feel like it. And if you want to reach us at Alzheimer's Disease International, you can always reach me through the conference platform or through my email that should be on the conference platform. So I'm going to wait a few extra minutes to see if there are any questions, but I cannot currently see any questions popping out. No, we have got a question now from Evelyn Campoverde. She asks, have you found difficult or reject reason for the delay in governments for implement the national plans for dementia in Latin America? Well, each country in Latin America, as you well know, is very, very different. And your governments, wherever you are, have adopted very different responses. Currently, the only country in South America that has a plan is Chile. And even in Chile, there is some retrograde actions that make me think we may need a little more action in the future. Big countries and wealthy countries like Argentina or Uruguay do not actually have plans. In Argentina, the government told me that their priority were in other areas like water and sanitation or maternal health. In other countries, the excuse will be other priorities. But we are making inroads. There is quite a lot that is happening in Brazil. I have had some very positive news just this morning. We have seen some positive action, if not a plan, in other countries like Uruguay. We have seen quite a lot of work in Argentina, although we are very far from a national plan. There is a regional plan of the region of Tucumán. And in other parts of Latin America, our association, there are associations of ADI in every country apart from Paraguay, are making steps forward. In Central America, Costa Rica has based this plan on human rights, and that has been really interesting. You know, the way that they use the derecho de adultos mejores as a weapon, in a way, to improve the lives of those in the country. The human rights approach in South America is always fascinating for me. There is a lot of community spirit. There is a strong feeling that something needs to be done. And there are these consejos de adultos mejores that do hold a capacity to bring governments into account. But there are also governments, for example, I'm thinking of Peru, Bolivia, where for many, many years we have tried to make some inroads with governments and nothing much has happened. So each one of you in this audience, you may know, you may have contacts with governments, and we would be delighted to hear about them. I have told you about our What's Your Plan campaign. That has been incredibly successful so far in dislodging governments. But you know, if I write to a government and the government tells me that they're doing something, that is wonderful, but I want to know what are they doing and exactly how they are executing what they're planning to do. And so we intend now to write and write and write and visit and go in person until something will get done. And then if nothing gets done, deploy these social media and standard media campaigns to mobilize public opinion. You are the gerontologist, you're a geriatrician, you know dementia is the 7th leading cause of death. It's just there, it's not gonna go. So my job is to make sure that governments are aware of that. And yes, it is still very difficult in South America. I think it's incredible that with so many members of ADI association and people working so hard, we still do not have more national dementia plans in South America. I hope this answers your question, Evelyn. And I'm not sure if there are other preguntas. If there are, please let me know, and I'll be very happy to answer them. It's very tricky with the online
system, isn't it? Because I cannot see you, so I cannot see if there are little hands raised midway. But I think that probably this was the whole of the questions. So I presume that we can probably finish this session, and that if you will want to know something more about ADI, about World Alzheimer's Month, about how you can help, or if you have a way for us to reach out to your governments, you will let me know separately. So with many thanks to Jose Ricardo for inviting me to speak, I think I will pass this back to the management of the conference. And I will wish you a very good evening, or morning in your case. Thank you.